Hello, I'm Matthew Ferris of Ferris Benefit Group. Once again, I'm the founder, also an insurance broker, and this is one of many videos that we're talking about health insurance, life insurance, disability. For this video, we're going to focus on private health care. Last video, we talked about the Affordable Care Act, ACA, Obamacare, and kind of broke down what are the components of there and what does that mean to certain people. Now we're going to talk about another group of people. So a lot of times when I'm helping different clients and to look at and explore their health insurance options, I run across a client that's healthy. They don't really have any issues going on at all. Some of them haven't been to the doctor in several years. And they're in a situation where they're doing well enough, either with their job or their business, where they don't qualify for financial aid. So like I mentioned, there's a lot of people that get plans for free or plans for very low cost. But once you make over a certain amount, the government's like, oh, you know what, you're good, you're on your own. You can still get the plan, but they won't help you pay for it. So we talked about when the Affordable Care Act took place about 13 years ago. During that time, there was a lot of financial institutions, a lot of life insurance companies that started their own form of health coverage because for various reasons, people didn't want Obamacare. One of the reasons why I can think about, in Texas at least, and some other states, is that they only have HMOs. Now, that's gonna be a whole nother video later about HMOs, PPOs, and networks, but what I will talk about is that the HMOs do have limited networks, which could be making it harder to access some of the doctors you need if you're on the HMO. You just have to be more prepared. So when I run across somebody that's have higher income to the point where they can't get financial aid and also they're healthy, I will have a conversation with them about private health care. So private health care is a good situation for people like that because I use an example of getting an arranged marriage versus dating somebody, right? So imagine plans under the Affordable Care Act, they're an arranged marriage. You're gonna have to take, the insurance company's gonna have to take you on whether they want you or not. It's arranged, right? While the private health insurance company, they're gonna kind of date you a little bit. And what I mean by that is not actually take you out to dinner. What I mean is that they're gonna look at your health. And what they do is that there's a couple different areas they do that with. One is the MIB report, not Men in Black, but Medical Information Bureau. And there's pretty much a list of codes that explains your health. And then the next thing is IntelliScript, which is for prescriptions. So they look at that to see if you're taking any expensive prescriptions, to see if you have any critical chronic illnesses. They also look at your height and weight, maybe even some of your record and everything, see how you're driving, if you're accident prone. And based upon that, they'll actually offer you a plan that's usually somewhere between 30 to 50% cheaper than what it would be with the Affordable Care Act plans, the ACA plans, if you don't get a subsidy. So these are actually vast financial savings. I was able to help somebody out recently and put them on a private insurance plan. I was able to save them about $350 a month from what they're paying going the route of the Affordable Care Act. So some of the benefits of using a private healthcare company is that most of these plans are PPO. So if you're in a state like Texas where you can only get HMO plans in the marketplace, now you have the availability to go to places you couldn't access on an HMO plan. That's a huge benefit. For example, Texas Children. I have some clients that want to take their kids to Texas Children. Unfortunately, at this time, there's no way to do that with Obamacare, ACA plans here in Texas, but you can do that on a private health insurance plan. Another benefit is that it has first dollar benefits. So we're gonna get into this in another video about deductibles and out-of-pockets and co-pays, but to kind of narrow down and focus on this, a deductible is pretty much a limit that the insurance companies will set so that they won't pay for most of the expensive things until you hit that dollar limit. So with the private insurance plan, a lot of those, they give you first dollar benefit where you can have access to money to take care of things like surgery, take care of things like urgent care visits, doctor visits, medicine, all those things that you need where you don't have to hit a deductible initially to be able to pay for those things and you have to pay from out of pocket. With the private insurance plan, they give you money right away to pay for those things, which is a huge benefit. Now, on the other side with private insurance, once again, I mentioned that not everybody can qualify. There are some cases that somebody might have a health condition going on where they wouldn't qualify for that. And what we do at FBG, Ferris Benefit Group, that we ask those questions up front before we even go to the plan details or do an application to get a really good idea if it's something the insurance company want to take on based upon the risk factor to them as well. And the other thing is that some of these plans do have exclusion limitations, which as an insurance broker, once again, we have a fiduciary responsibility to you. So we're gonna look at, it's our job to know all these exclusion limitations to make sure we match you with the right plan. But overall, I've helped, at least 100 or so people I can think of right at this point to get on private insurance plans that are very happy they've had them for years. And it's a great alternative for somebody who really might not be a good fit for ACA. So once again, if you know anybody, either yourself or anybody else that might be unhappy with their Obamacare ACA plan, might be unhappy with their group insurance plan, have them call us, have them contact us. We work with those programs as well, but we can probably help them find a private insurance plan if they're healthy enough to lower their costs and give them more benefits that they wouldn't have dealing with other types of insurance.